We hate to break it to you, but it is August 1st. As much as we don't want to, it is time to start thinking about back to school. Our health specialist, Leah Sarich, is here now with why getting your child's eyes checked before September should be a part of your back to school routine. This is a good idea.
It really should, yeah. And the main reason here is that 80% of learning happens through the eyes. So the bottom line is that if your child is not seeing properly at school, they're not learning properly.
That makes a lot of sense.
It does.
That 1 in 4 children have an undiagnosed vision problem that interferes with learning. A vision screener that's performed by a school nurse or your physician or pediatrician is not meant to replace a comprehensive eye examination. Statistics show that 40% of students that pass a vision screening fail their comprehensive eye examination, because vision is not just about how well you see, it's about how well the eyes are functioning as well as how healthy they are.
There you go. So let's revisit that. 1 in 4 children have an undiagnosed eye problem. So this is why it's so important to get them in there and get them checked out. What also can happen if your child has an undiagnosed eye problem is they may not be seeing and learning properly, and that could lead to a misdiagnosis of something like a learning disorder. Or even an attention disorder like ADHD. This happens quite often. So you want to rule out that their vision's okay and something else is going on.
Right.
The other thing, of course, the Dr. Sunderji mentioned, they're going to look at things like whether or not your child might have allergies that are affecting their eyes, whether they've got dry eye, conjunctivitis, whether they even have an underlying medical condition that requires further investigation in that eye.
Okay, so we're talking about kids here. So does a child's eye exam look a little bit different, particularly in kids who may not be reading yet?
Exactly, so it does. So, you know, we go to the eye doctor and we look at the letters on the sheet. So that is not what the kids are going to do, especially if they can't read. They'll use a little sheet just like that one there. So you can say, oh, can you see the birdie? Can you see the kitty cat? That kind of thing. She's got little toys like this little guy, which will help do the tracking of the eye. This is for color blindness, right? You have to look for color blindness. There's Winnie the Pooh there. She's looking for depth perception there. So these are all things that she's checking for. That's depth perception again, whether things are going to pop out or not for your child. They get to wear fun little glasses and things like that. So yeah, it looks very, very different. So she's looking for those vision skills, eye coordination, eye tracking, things like that. And as the years go on, parents should really watch for other various symptoms and then report them back to the optometrist when they go every year.
I encourage parents and children to monitor for various symptoms, and those include blurry vision, any type of squinting, headaches, eye strain, fatigue, monitoring for double vision, a strabismus, which is an eye turn, as well as if you're noticing your child is tipping their head or tilting it, or a head turn at various distances, monitoring for excessive blinking, tearing, or watering. These are really important to bring up with your optometrist because we can determine a cause as well as the best treatment option.
Right? So we probably don't even think about those things. You know, if you see your kid going like this, you think, oh, there's something going on there. Let your optometrist know. That's why we go once a year. So Dr. Sunderji is recommending that parents watch for also for how the child is learning. So not only for those head tilts and things like that, but if they're skipping words or letters, or if they're reversing letters when they're writing, things like that, all things to bring up with the optometrist, for sure.
Okay, I shuddered. I hate to ask this question because I know I'm going to get in trouble here. How old should your child be at their first exam?
Okay, well, ideally, the optometrist would love to see your child at 6 months of age, if you can believe it. At 6 months, true story. And then annually after that. But realistically, they would really, really like it, at least if you can get them in there before the school year starts. So that would be great.
Okay.
And 2 things I have to mention very quickly is that it's free for all children in Alberta to go do this. So there's no excuse. You really just have to go out there and get this done. It is absolutely free. And then if your child is going to kindergarten, they can actually get a free pair of eyeglasses if they require them through the I See, I Learn program. So really, this is open to all children in Alberta. It's such a good idea to get their eyes checked before they go back to school.
Okay.